The main dangers of alcohol and drug abuse or use is a safety factor. I mean, that's the overriding concern.
Thank you. We can all agree that alcohol and drug-free workplaces save lives. Therefore, when you're supervising employees who perform safety-sensitive functions, you need to be on constant lookout for illegal drug use. Reasonable suspicion of drug use can be determined in a number of ways. First, you should be able to recognize the illegal substance or the paraphernalia that is used with it. Second, observe your employees. Is anyone exhibiting signs or symptoms of drug use? There are 4 short-term indicators of illegal drug use. These include physical appearance, behavior, speech, and body odors. We're going to talk about the 5 drugs prohibited by the Federal Transit Administration. These are cocaine, marijuana, amphetamines, opiates, and phencyclidine, or more commonly referred to as PCP. We'll take them one at a time. One thing you should remember, it's not your job to diagnose exactly what specific substance is being used. You just need to recognize specific types of behavior that may indicate illegal drug use. Again, to better help you make your reasonable suspicion determination, we're going to use an actor to demonstrate some of the signs and symptoms you should watch for.
The first prohibited drug is cocaine, one of the most widely used illegal drugs. Cocaine is a powerful physical and mental stimulant that is usually snorted into the nose, rubbed on the gums, or injected into the veins. Common paraphernalia include a single-edged razor blade and a small mirror or piece of smooth metal, a rolled-up dollar bill or a half-straw or metal tube, and a small screw cap vial or folded paper packet containing cocaine. Crack, which is a derivative of cocaine, looks like small rocks. It is commonly smoked from a crushed aluminum can with pinholes and occasionally from a glass pipe. There are a variety of signs and symptoms of cocaine use. A runny or irritated nose, dilated pupils, unusual defensiveness, agitation, restlessness, and difficulty in concentration. Marijuana is another widely used drug. It acts as a mild tranquilizer and alters perception. Marijuana is a green to brown leafy material that resembles oregano and can be rolled into joints or smoked from a pipe. Often, a cigar is hollowed out and filled with marijuana. Another variety of marijuana is hashish or hash, a compressed tar-like substance ranging in color from pale yellow to black. It is usually sold in small chunks wrapped in aluminum foil. It is also smoked from a pipe. Some of the signs and symptoms of marijuana use that should be watched for are bloodshot eyes, lack of motivation, diminished concentration, distortions in time estimations, increased appetite, and seemingly uncontrollable laughter, slowed speech on a lackadaisical, I don't care attitude. Another indicator of marijuana use is its distinctive odor. It has a pungent aroma resembling a combination of sweet alfalfa and incense, and usually lingers on the user's clothing. Amphetamines are sold in counterfeit capsules or as white, flat, double-scored mini-bennies. They act as central nervous system stimulants and speed up the mind and body. They are usually taken by mouth. Signs and symptoms of their use can include dilated pupils, profuse sweating, hyperexcitability and restlessness, and usually aggressive behavior. Amphetamine users can also be prone to impulsive and risk-taking behavior, not the kind of behavior that is appropriate for people in safety-sensitive occupations. Opiates are narcotics, such as opium, heroin, morphine, and codeine. They alleviate pain, depress body functions, and slow reactions. Opiates may be taken in pill form, or they may be smoked or injected. Some of the signs and symptoms of opiate use are difficulty in breathing, constricted pupils, lack of coordination, physical fatigue and drowsiness, possible puncture marks or tracks on the arms caused by needles. Opiate users often suffer from excessive itching as a result of drug use. Commonly called PCP, phencyclidine is used infrequently today. It is not generally used in the workplace because of the severe disorientation that occurs, but you, as a supervisor, must be aware of it. Phencyclidine is a tranquilizer. It is commonly sold as a clear liquid and occasionally as a creamy granular powder, packaged in 1-inch square aluminum foil or folded into packets. Marijuana joints or cigarettes are often dipped or sprayed with PCP. The drug is also smoked and snorted. The potential for accidents and overdose emergencies with PCP is high because of the extreme mental effects combined with the anesthetic effect it has on the body. Some signs and symptoms of PCP use are violent or combative behavior, dilated pupils, extreme mood swings, and agitation. PCP users also display severe confusion as well as an inability to speak coherently.
Those are the 5 illegal drugs and some of the classic symptoms of drug use. You need to keep in mind that some users will use 2 or more drugs at one time or combine drugs with alcohol. These people are known as polyusers. The effects of polydrug use vary widely depending on the combination of drugs involved. If you have reasonable suspicion that one of your employees is using any of these drugs or a combination of drugs or drugs and alcohol, immediately inform them that they're being referred for a reasonable suspicion test.